Hello, everybody. I'm so excited to be in the presence of so many greats, and I see a lot of friends out there. So I'm really happy that WHN gave me the opportunity to participate. And without further ado, we've heard a lot of good science and a lot of good information. I want to flip the script a little bit, and I want to talk a little bit more. From an implementation standpoint, a little bit more away from the science and a little bit more into like how do we effectively deploy some of the tools that we know and have, particularly in healthcare where I work. And actually, I have a little bit of an advantage in my clinics because we deal with people with complex chronic conditions. And so a lot of our people are immune dysregulated. And I think I have an easier time sort of justifying the multiple layers of mitigation that we've implemented versus, say, a regular primary care clinic or a regular healthcare setting. So, but I just wanted to share my thoughts. And let me see if I can share my screen about what that would look like, trying to basically be an advocate across the board for effective implementation of clean air in healthcare. So hopefully you guys have my slide up. And so basically, when I come to think about like implementation of clean air in healthcare, the first thing I think about is the Hippocratic Oath and doing no harm. First, do no harm is the main tenet of the Hippocratic Oath, and everyone knows that, you know, particularly physicians, but even other medical professionals are sort of bound by this. And nobody gets into medicine because they don't want to help people or don't want to do a good job in making people feel better or have a better quality of life. I really do believe that if you choose healthcare as a profession, then the people who choose healthcare do want to improve their patients' outcomes. And so building on this do no harm is one way that I've learned to present implementation of the mitigations in a healthcare setting. So it should be enough that we can talk about preventing the nosocomial infections. You know, that's an infection acquired in a healthcare setting. And as of March in 2023, the Omicron studies ranged sort of wildly, and I'm sure that varies depending on how the different healthcare facilities have implemented their layers of prevention. But, you know, from 4.7% to 30.9%. And, you know, it's really just about sort of worst case scenario that you go to seek healthcare or you're already in some sort of compromised position where you need a procedure or surgery or a consult, and then you catch COVID on top of that. So one thing that we do talk about and advocate is, you know, definitely preventing these nosocomial infections. And then we have the whole, you know, other kind of, you know, medical argument, and I'm talking about some medical arguments here that we want to prevent the COVID sequelae, including and but not limited to long COVID. So I think we all understand and know the long COVID prevalence somewhere around 15-20% is what it seems like it's sort of falling out at. It sort of increases the more times you get reinfected, and long COVID is a big deal. But what's a little bit less talked about, and what we do see also in our clinic besides long COVID, we see these sort of one-offs that are also, they're not technically long COVID, but they're sequelae of COVID infections and multiple COVID infections. Things like gastroparesis, where you can't, you know, go to the bathroom. Things like acute liver injury or liver enzyme elevation. I mean, everyone knows about like the heart inflammation that can come along with COVID or lung problems, but you may not hear as much about like the positive ANAs and autoimmune conditions that are being triggered by COVID infections. And so, when I appeal to the Hippocratic Oath, I would definitely like to, you know, bring the medical arguments in and say, hey, you know, we're supposed to be, you know, healing people and not causing infection. We're supposed to be preventing, you know, preventative care for sequelae and long COVID. But I'm going to tell you guys right now that not every environment, and I'm sure you guys know this, is like this environment here, where everyone's like, yes, we've got to clean the air. It's very important. We have all of these things that we need to do. And healthcare is stressed out right now. Healthcare basically has, you know, a lot of challenges. And some of them are pandemic, and some of them are sort of systemic challenges that we faced ahead of time. But, you know, since the pandemic, we've got a high level of burnout. We've got a lowered pool of people that are working in healthcare. We've got supply chain issues. I mean, just in the past I don't know, probably 9 months or so, we've had shortages, maybe a year. We've had shortages of things like lidocaine to numb people, albuterol, ADHD medications, basic antibiotics. Like right now, we can't get liquid amoxicillin, and so we've got supply chain issues along with this still ongoing pandemic happening and all of the sequelae of the pandemic. I mean, healthcare workers are also not immune to long COVID and even sort of the cognitive hits that happened. And so when I start thinking about healthcare and I'm walking around like Hippocrates and I'm like, let's first do no harm, we keep running up to against this this bottom line. This let's not do we can do no harm, but what is it going to cost us? Along with all of these other stressors and things we're dealing with, how is this actually going to help healthcare in the U.S.? It's privatized. It's a business. Even in the bigger institutions, we have to look at the bottom line. And so, how do we sell sort of these mitigations? How do we effectively advocate to implement all of these tools that we have, keeping in mind the the burnout and the other challenges that the healthcare industry right now is actually facing. And so the way I've approached it and been successful, like I said, in our own clinics, and even advocating in some of our partners, our collaborators, our other we have sort of a network of physicians that we talk to and refer, is by using these other intangibles that actually do help drive your bottom line in healthcare, besides just the medical arguments. We have the medical arguments. A lot of people may or may not actually understand some of the medical arguments, particularly the sequelae, but everybody understands these sort of intangibles. If you get someone sick when they come to your healthcare facility, they're not going to be very satisfied. They're not going to be very happy with you. And patient satisfaction is a big deal in healthcare. We have all these surveys and reviews and all these metrics that we want to meet, and as we should. And so making sure that less infection equals better patient satisfaction is a great talking point if you're talking to investor groups for private clinics, or you're talking to your administration in a larger healthcare setting. Knowing that not infecting people makes them more satisfied with you is something it would seem basic to point out, but we also remember we're dealing with sort of a we have this whole pervasive sort of denial and everything is over and COVID's not a big deal. And then we also have some of the cognitive stuff that's, I think, hitting us sort of societally. So stating the obvious sometimes, patients will be better satisfied with you if you don't infect them, sometimes actually can advance your goal. And then, of course, better patient satisfaction not only leads to better publicity, but also when you can advertise yourself as a COVID-safe clinic and people can, have the confidence to come and get COVID-safe care. I think this is a little bit of a lesser point just because there's not as much demand now for COVID-safe care. We definitely have a lot of work to do in terms of public awareness and public health messaging, which I know there's going to be a session on later. I think Shay's going to talk about, but we still can say, look, if we're not infecting people, we have better patient satisfaction. We are advertising that we're caring for our patients. We're going the extra mile. We have these mitigations in place for our patients. And then on the flip side, because there is this sort of strain on the healthcare system, we have better employee attendance if our employees are not getting sick and they're protected from infections, not just COVID. And a lot of times I'll even start saying that, when I'm talking about our mitigations, I'll be like, yes, we are preventing COVID and staph and strep and all of the other kinds of, RSV and the flu and everything else that keeps people out of the workplace with our mitigations that we're actually, largely implementing for COVID. And then better.
I just wanted to let you know you have 1 minute.
Sure. And then better employee safety in terms of employee retention, because if you get, if your employee gets sick and they take a cognitive hit, and then they may or may not be able to continue in the future. And so you've heard about the tools, you've heard about filtration, there's our Clean Air Kit friends, you've heard about FAR UV, our sterile ray friends, masking, all of those things. We can do all of these things, but in terms of implementing them after we know what to do, then we have to, basically sort of convince the powers that be or the people around us that to actually let us do them. And so my last little point was, when you're looking at things to implement, you sort of also want to keep in mind that things like ventilation, filtration, and FAR UV actually, in my experience, even though they might be a little bit more expensive, can actually be easier to implement than actively asking people to do things like put on mask and test. And our clinic has them all. We have mask, test, ventilation, filtration, and far UV. But when we talk to other sort of partners and people, everyone seems to be really open to, air filters or, improving their ventilation status or even the far UV stuff. And there's a little bit more reticence for the mask and the test. So anyway, that is what I wanted to sort of share with you in terms of my thoughts on implementation today. Thanks for having me, and I'll be quiet now.